In many hospitals there are patients who need to undergo knee replacement surgery. This is the case with 78-year-old Mr. Jansen. His left knee was replaced 2 years ago after his previous operation. Pain, inflammation and swelling were suppressed as far as possible with medicine and ice therapy. A painful and lengthy recovery process. Today his right knee will be replaced. He has serious arthritis and an operation is unavoidable. After being fully informed by his orthopedic surgeon, he looks forward with confidence to step into a new world. Cryotherapy using ice packs is a disadvantage of uncontrolled cooling taking place at a temperature below 0 degrees to reduce the swelling. This can result in frostbite and even permanent nerve damage. Ice therapy is an arduous, uncontrolled and passive method. Due to its even insulating effect, the cooling is unable to penetrate deep into the joint, thereby failing to achieve the desired effect. Seat treatment is developed in order to extract energy from target tissue in a controlled way. The result is exactly the correct temperature drop of the tissue in and around the knee joint. The contact temperature never drops below 8 degrees, thereby eliminating the chance of possible risks. It's important of this kind of energy extraction results in deep penetration into all the tissues and the joint. What is expected of you? The nurse or a physiotherapist attaches the C-pad before the operation, which then ensures the correct interaction with the patient. It's important to attach the C-pad without folds. The combination of deep penetration and compression provides the synergetic effect and prevents serious inflammation, swelling, and pain. Check whether 2 fingers can be stated between the skin and the C-pad. The system regulates the compression. The server sleeve can be easily connected to the C-pad. Ensure the tubes are free and are placed on the exterior of the C-pad so the fluid can circulate easily. The tubes are made towards the feet pre-operatively. The server automatically recognizes the type of C-pad and will regulate it by means of a C protocol, which was specially developed for this indication. After connecting the C-pad, the treatment concerned will be automatically displayed on the screen. On the next screen there's a choice menu. Pre-operative, recovery, day 1 and consequent days. In this case you choose pre-operative and press the play button. The therapy then begins and the timeline starts running. When the therapeutic time is up, the server will automatically stop the therapy. Via a chip, the C-pad registers which phase the patient has undergone. This means the treatment can be interrupted. For example, if during energy extraction the patient has to go to the toilet. However, the patient must be informed before treatment that it's better not to interrupt it. It's important the patient is treated to preoperatively with C treatment to anticipate the trauma caused by the operation. With the conventional treatment strategy, serious inflammation occurs resulting in swelling. The temperature and the joint will also rise. This is a painful experience for the patient. Extracting energy in a controlled way helps to delay this process. What happens in the tissue and joint during treatment? Thanks to the circulation of the specially developed fluid in the C-pad, energy is extracted in a controlled way. The result is a slowing of the metabolism, vascular constriction, reduction of edema formation, slowing of nerve conduction and pain inhibition. After 1 hour of C treatment, the patient is taken to the operating theater. The C-pad remains on the knee and accompanies the patient. After all, the C-pad remains attached to one specific patient during the entire treatment process. When the entire treatment is complete, the C-pad should be discarded. The anesthetist gives the patient and the TOT-ISIC injection via lumbar puncture. Many years of experience with C treatment has shown that patients suffer fewer complications and less blood loss. Post-operative pain is also considerably reduced. So much though a NICE can considerably lower the pain medication. Physiotherapists experience faster and better revalidation compared to standard treatments. The accompanying C-pad is removed shortly before disinfecting the operation area. Make sure the C-pad remains closed by. Immediately after binding the wound, the C-pad should be applied again. Total knee replacement is an intrusive operation. This time the surgeon is operating without a tourniquet. During the operation there is less blood loss, and also after the operation there is less swelling, consequently much less pain and faster revalidation. After the operation wound has been closed, it's covered and bound with an elastic bandage without cotton wool wands. Then the patient's personal C-pad is attached again. This is usually done by the operation assistant or the anesthesia nurse. The tubes now point in the direction of the groin. This is important for the patient's freedom of movement during revalidation. The anesthesia assistant then attaches the C-pad to the server in the recovery room. The patient's C-pad is recognized by the server and will automatically continue the treatment. The assistant only has to press the play button. If it's not possible to carry out the treatment in the recovery room, the treatment can be easily continued in the patient's room. In the days after the operation, the joint is repeatedly subjected to C-treatment. It's important the physiotherapist or nursing staff check whether the blood flow in the leg remains sufficient. Soon after the operation, the patient is able to walk independently to the physiotherapy exercise room. Here too we see enormous progress compared to conventional physiotherapy. Visit our website for more information. ctreatment.com